What is psychotherapy? Does it work or is it all a scam? We hear this word all the time, therapy or psychotherapy. But what is it actually? Does it work? If it does, why? Is it just talking? Is it just placebo? Or is something deeper happening beneath the surface? Psychotherapy in its most basic form is a structured interaction between a client and a therapist with the goal of improving emotional, physical, cognitive, or behavioral functioning. But they all share the same thing in common. They create a relational space where change becomes possible. Psychotherapy has consistently shown to be effective for anxiety, depression, PTSD, chronic pain, and even physical health outcomes. Some meta-analysis studies show that it's just as effective and in many cases even more effective than medication. Researchers have spent decades trying to figure out what makes therapy effective. And it turns out it's not about which form of therapy you use, it's about what all effective therapies have in common. Let's talk about the elephant in the room, placebo. We've talked about placebo in our other videos where studies show that people improve even when they know they're getting a placebo. Because expectation, safety, and hope lower brain's threat response. And that's exactly what psychotherapy also does. If we want to know what component of therapy consistently leads to real measurable change, it's this exposure. Facing what you're afraid of, sitting with thoughts, feelings, and emotions, or sensations you'd normally avoid. But why does this matter? Because avoidance feeds fear, but approach rewires it. Psychotherapy is not just talking. It's training your brain to respond differently to threat. Not because you're being fixed, but because your brain is learning and being updated. And if you're ready to start training your brain to feel safe again, visit us at ihealthpsychology.com. And please follow us on our social media accounts for more content. Thank you.